Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.
But first, Gabriel McSharry, a medical herbalist and nutritionist, is in studio. Gabriel, good morning and thanks for coming in to us this morning. Gabriel, firstly, our listeners can send in questions to 0818 365 500 is our phone number, and 083 3500 530 is our text number. And our first call in today, this listener suffers from a lot of wax in my ear. How can I prevent this from happening?
Yeah, that's a good one. Some people are just more susceptible to producing earwax. I don't fully understand it, but sometimes garlic drops can help. So it's drops of an oil that's made by it's a garlic oil. So you soak garlic in the oil for a number of weeks. You make an oil extraction of it, and it helps with all ear infections and anything like that. And it can help loosen up the wax, but I'm not too sure does it reduce it. Definitely helps reduction in any if the wax is causing infection. It'll help there. Okay,
now, is it that people aren't cleaning their ears properly, or is it that naturally some people just seem to get a build up of wax?
I think it's the latter. I think there's just certain individuals are prone to producing a lot of earwax. And I don't think it's anything to do with that they're not cleaning their ears,
Yeah, some people are saying, like, when you use, say, cotton buds or whatever to clean the ears, that they're pushing the cotton bud in too far or something like that.
There, yeah, I'd avoid cottonwood buds, especially with, I know specifically with water, if you get if you're swimming in the sea or in a pool and you get water in your ear, the big no-no is to get a cotton wool bud and try and kind of get it out that way, because you just push it down. And you'll make things worse. My guess is it's the same with the wax, though. I wouldn't use cotton wool buds to try and get wax out. You'll only probably push it down, impact it up against the drum. There is people who just sequentially will have to get their ears syringed, in that after a certain amount of build-up of wax, it kind of affects hearing. And those individuals, I don't think there's anything really you can do about that, but definitely a garlic oil will soften up the wax, and it may not build up as fast. And if the wax causes infection or anything like that, then the garlic oil will address that as well.
Okay, listener with a sty on their eye, what can they do about that?
Yeah, immune system tonics internally, echinacea, astragalus, tabibua, they're herbs, also vitamin D. If one's getting recurrent styes, it's definitely an indication immune system isn't up to par. Now, topically, calendula is a herb, a good affinity for the eyes, or used traditionally for any kind of eye infection or anything like that. So you just make a tea out of the calendula flowers. So you soak maybe half a handful and in boiling water, and then you run it through cheesecloth just to get all the solid particles out and let it cool, and then use the resultant liquid as an eye wash. You can get an eye bath in a chemist, or a small, it look like a little shot glass, and you just you can use it to wash the eye out, but you can just use the damp flowers of calendula itself topically onto the eye, on the sty, and leave them there for 20 minutes if you can, let it soak in, and that'll definitely help them to go away,
And the tea bag trick where people use cold tea bags on their eyes, is that more to brighten them up or cool them down? Or
if you could do that with a calendula tea, brilliant, I'm not too sure does Camellia sinensis tea itself have a medicinal effect, or is it something to do with temperature? It might definitely soothe the area if it was cold. With styes you have inflammation, and with inflammation you have heat and pain, and maybe the coldness will kind of dampen down the inflammation a bit and maybe reduce a bit of the pain. But in general, I'd get calendula petals or flowers, and I'd make the tea from it and then apply them topically. Brilliant eye tonic.
Okay, and again, it's all down, I suppose, to your immune system and the fact that people get them. And
if they're recurrent, the odds die maybe here and there, but if they're recurrent, it's definitely a sign that the immune system is under par. And as I mentioned, some internals for the immune system, like golden seal, astragalus, echinacea, tabibua, they're my favourite. Zambucus as well, or elderflower. These are my favourite immune tonics, and all shown scientifically to improve immune function. And there might be some generalised internal herbs with a specific to the eyes, like eyebright.
Okay, a listener out walking finds it hard sometimes to breathe. Is it this heat? Because they are pretty fit. Could it be the heat or the...
No, I doubt it. I don't think the heat, it may be, though, pollens.
Could be an allergy, or pollens,
yeah. I'd get it looked into, though, I mean, difficulty to breathe isn't good, especially on exertion, and I'd have it checked out, maybe... contact your GP. Just look into it. Possibly allergies, though, to certain pollens affecting the lungs.
Your breathing exercise for panic attacks, again, that's one we're asked for a million times over.
Yeah, it's a brilliant exercise.
There's not a day that goes by that someone on that phone doesn't ask me what does Gabriel say about breathing.
It's very effective. I have it on my website, westernherbmedicine.com, if anyone's ever looking at it, but it's very simple. It's the 4-7-8 breathing exercise, and basically you breathe in for 4 seconds, you hold your breath for 7 seconds, and you breathe out for 8 seconds, as if you're blowing, like that's how you breathe out. And you can repeat that a number of times, and it's really good at just calming down the nervous system. So it can be done anytime in a queue, in a traffic jam, and whenever you're wound up.
Actually someone said to me that they were in a crowd one day, and they thought that they were going to faint. They just felt themselves getting dizzy, and they remembered you speaking about it on the radio show, and they started to do it.
Yeah.
And they said all of a sudden they just calmed down, but they just felt that they were going to faint, and they thought, okay, stay calm. And they did that exercise, and it calmed them down totally.
Yeah. Well, I actually was doing herbal formulas for one of the contestants in The Voice of Ireland there recently during the winter that the show was on RTE. And at the time, I just suggested to her this breathing exercise just for before performance. And I think she was a wedding singer anyway for years, but she definitely found it helpful, so for performance, any public speaking. That's all anxiety. It's the same systems in the body that kind of trigger, and our breath is strongly linked to the nervous system, the way we breathe, and it's just it's a message that always be aware of breath, and breathing exercises in general are pretty good,
Okay, is there any recommendation for what has been called halo mold, warts with white rings around them?
Yeah, we were asked this before, and I never looked into it. Maybe if they give me a ring at the clinic, I'll look into it for them. I don't know anything specific to the halo molds, but warts, for that virus, there's topically tea tree oil undiluted applied after a little bit of abrasion. This is general warts. Now, I'm not too sure about these specific halo warts, so maybe it's not specific to this, but general warts, if you have that virus, then there's topical antivirals. Undiluted essential oil of tea tree is strong antiviral, but also thea is a herb, THJUI, and it's antiviral, and I just get them with a small bit of sandpaper to sand a little bit at the top of it, and then apply it so it soaks in.
That sounds so. Sandpaper on your...
Yeah, actually, funny enough, a few years ago, I said the same on the show. I think Niall was here, and someone said if they got an electric sander, I think that'd be way too much.
I think that'd be way over the top.
The point is just to take some of the surface dead skin off, so the herb soaks in, and it's antiviral. Sometimes covering them with duct tape for a period of time can kind of smother them out as well, but that's mainly if you have them on the feet.
Exactly, but a bit unsightly, but hopefully that'll work. Okay, this is my second time in 6 months to get iritis. Iritis, what is the cause? I'm on steroid drops at the moment, but the pain is still bad, and I seem to have a lazy eyelid. Now, they just spelled to get or could be part of a spelling missing then? I-R-I-T-I-S.
Oh, iritis. Yeah, so it's an inflammation
Iritis.
in the eye, yeah.
Okay.
It'd be iritis. I think it's an inflammation of the iris in the eye, part of the eye. And the drops they used, the steroid drops, just calms down the inflammation locally. But is the question that it's
at the moment, but yeah, is the cause every 6 months? The second time in 6 months.
Right.
And what is the cause? On steroid drops at the moment, but the pain is still bad, and I seem to have a lazy eyelid.
Yeah, now it is important to find out the cause, and it could be environmental, so foreign entities getting in if you work in a dusty environment or any kind of environment where there be certain particles that would irritate or infect the eye. It's very important there, and if that's the case, maybe you need to wear eyeglasses or protective glasses. Yeah, with all inflammation, it's generally an infection. If it's not just an environmental irritation, and with that, immune system then plays a positive role. If it's something that's been ongoing for 6 months, one wonders at this stage the infection should be gone. So one wonders, is it kind of getting into an area of an autoimmune condition where the immune system is a little bit out of whack and it's attacking the iris. And in these cases, they do use steroids. They should never be used long term, and you should always look at looking at a long term resolve to it. But for all autoimmune conditions, I have a certain protocol at the clinic, and it works on the immune system to calm it down, stop attacking itself pretty much. But one thing is vitamin D here. If you get vitamin D into your high normal levels, so you'll have to get your blood tested for vitamin D and then supplement till you get it up to high normal, and it's really good for all autoimmune conditions and inflammatory conditions.
Okay, a fast heartbeat, serious over 128, so I presume they're getting rapid heartbeat.
Yeah, I'm assuming they've got it checked out, and they just maybe get generalised palpitations. If you haven't, make an appointment with a GP or see a healthcare professional. Get it checked out. Get thyroid function checked. Generally, if the thyroid goes overactive, very common thing to happen is the heart goes over. Everything goes overactive, really, but the thyroid is the kind of main controller there. And you got to look into why you're getting the palpitations. Commonly in females, it's hormonal, but it can also be anxiety disorder, as well as organic functional pathology in the heart and vascular system can cause it as well. So that's why it needs to be really checked out. There's no general
so they really need to get it checked out with a consultant. Okay. What do you suggest before a driving test? I presume you're breathing exercise again. I presume they're talking about trying to keep them calm.
Yeah, definitely. And I put out a kind of an article every year around exam time, and it's very topical today. I even get nervous the night before the results come out, and I've done the leaving cert, I don't know how long ago, but I get nervous for the kids.
You're reliving it again, Gabriel.
Yeah, but it's I know it's a very tough time for them, and hope everyone does well today. But it's similar. Any kind of examination or performance that's coming up, and that's athletic performance as well. I know in the Olympics, some of the Olympians take adaptogen tonics and nervine tonics. So they're herbs that work on the nervous system. They're very safe and effective. You don't need to be ill. They're tonic herbs. So they work by calming the nervous system. They improve sleep if sleep is a problem, and generally is around exam time or coming up to a test. And sometimes you see the nervous system can really reduce your ability, to do well in the driving test. Obviously, if you're going to be very anxious. So I take these tonics. If you're a type of person who gets very anxious coming up to exams or driving tests or whatever kind of programs, even interviews, you can take the tonics a long time in advance, a couple of weeks in advance. So that's the best time to take them. There's few herbal medicines that you take, we'll say an hour before or even the night before, that work very, very well. But there can be some that have that acute action, but they're best taken a couple of weeks in the run up to the exam. They're valerian, St. John's wort, vervain, melissa or lemon balm. These are all nervine tonics. Beautiful.
Okay, the cause of sweating a lot after eating, after eating, and they're saying which is becoming very distressing, ongoing all the time. Would that be the type of foods that they're taking, or why would that be?
Possibly, but more so, I'd say if it's excessive sweating and a problem, it's hormonal. And it's again, it's summertime, and maybe it is if you're eating spicy hot foods or warming foods. Definitely, there's thermogenic foods. There alcohol, caffeine, cayenne pepper or chilies, ginger root, horseradish, black pepper. These are all thermogenic foods, and they can, by their name, they increase the temperature of the body, and maybe you're just consuming a lot of these for whatever reason, and the climate's warmer. But in general, if it's excessive sweating after eating, just come on all of a sudden, I'd look into kind of a hormonal component.
Okay. Now, we have a lot of questions in here, which we're going to have to hold over. But just before I let you go, I'll ask you a final question. What about people who are short of breath in Ecure? Again, is that something they need to check out with
to be looked into, yeah, definitely.
Their GP. The cause of headache, heavy weight around back of head, and sore muscles down both sides of the shoulder.
Again, any headache needs to be investigated as well in a clinical setting. But if they have sore muscles around the shoulder, I'm thinking it's a tension headache, and it's the cause is the musculature in the neck and the shoulders putting strain on the tendons and muscles going into the base of the skull, and that's causing the headache.
So check out headaches really if they're severe.
With any kind of headaches and they're not too sure, it's always good to get them checked out, because 9 times out of 10 there's something like maybe a pull muscle that's affecting it, or just some dehydration or dietary. But that's that rare occasion. It's something that needs to be really investigated quick. But sounds like tension, headaches, and like some massage therapy around the head and neck and shoulders and stuff like that will be very good for hot baths.
And hot baths. All right, Gabriel McSharry, medical herbalist and nutritionist. Thanks a million for coming in to me this morning. Of course, you're back with us in 2 weeks' time, and they'll get you on your website, westernherbalmedicine.com. That's it. Okay, thanks a million, Gabriel.
Thanks, Mario.
Gabriel McSharry, nutritionist and medical herbalist. A safe and effective approach to your health condition. Call the clinic on 071 9142 940.